RNAO. RNAO is the professional association for nurses in Ontario and promotes excellence in nursing practice and advancing nurses' contribution to the healthcare system. RNAO has a signature program called the International Affairs and Best Practice Guidelines Center that develops, disseminates, implements, and evaluates clinical and healthy work environment best practice guidelines. One of our practice guidelines is on smoking cessation, and as part of our smoking cessation initiative, we hold regular webinars to support building capacity amongst nurses and other healthcare providers to implement and sustain smoking cessation best practices. We want our webinars to be interactive and engaging. We encourage you to type in a question or comment in the chat box during the presentation. For the last 15 minutes or so, our presenter will address these questions. If we run out of time, our presenter has agreed to respond to your questions in writing. We will also be archiving these slides on our tobacco-free rnao.ca website so that they will be available for future viewing. Our speaker today is Andrew Noble from Smoke Free Housing Ontario. Andrew Noble has played key policy and public affairs roles in some of Canada's leading health nonprofits since 2006. In addition, he has had professional and personal experience within the nonprofit housing sector in Canada and in Kenya. He joined the team at the Smoking and Health Action Foundation as their policy analyst in October 2014 and is responsible for public education and outreach on smoke-free housing. Andrew holds a Master of Science and a Bachelor of Arts from the University of Guelph. Today's webinar addresses the fact that Ontario residents of multi-unit housing, such as apartments, continue to be involuntarily exposed to secondhand smoke, which is a known carcinogen. The scope of this health problem is quite large. About 1/3 of multi-unit housing residents report being exposed to secondhand smoke, and that's according to the Ontario Tobacco Research Unit, or OTRU. The webinar will discuss what can be done to face this public health challenge and what the social health and legal implications of residential buildings going completely smoke-free would be within private units. So let me go ahead and turn to Andrew to start the presentation. Andrew, please take it away.
Thank you for the warm welcome. I'm very pleased to be here. I'd like to thank Jen and Jen, who've helped me in many ways to put this together from the RNAO. So today's presentation will take about 45 minutes, and then we, as mentioned, will have some time for questions. So let's get started. I'm having a bit of a problem with the slides advancing, so I'd like you to hold on for just 1 minute. Advance them using the button. Okay, so I have put together a little agenda, and the agenda includes welcome and introductions, which is somewhat where we're now. There's a little bit more I put coming up. We also have information about secondhand smoke and multi-unit housing. Discuss what is smoke-free housing, what is smoke-free policy and why a smoke-free policy, and give you a sense of some advice that you might be able to offer housing providers or tenants. And there's a section at the end about what people are saying about smoke-free housing. This is a collection of quotes and pictures and people that are talking about smoke-free housing, including tenants. There's also I wanted to quickly go through just a few of our resources that we do have available on the subject, and of course take questions. In the welcome into introductions, well, this is me and this is my family. That's my son Thomas and my partner Sandy. We lived in a housing co-op. In fact, that's the co-op we were living in at the time for many years, and served on the board there and in the property management committee. I also have a background, as mentioned, that includes the Canadian Cancer Society and other health agencies, where I've worked in a public policy role, mainly on tobacco, but I've also done some work in other environmental carcinogens. As part of the welcome, I'd I'd like to mention again that we do have our Smoke-Free Housing Ontario website. That's the banner from it, and that will come up a number of times. It's a very good resource for people. And I'd like to thank the ministry for providing us with our funding. We get calls from about 300, so we get about 300 calls per year from about smoking in multi-unit housing, as well as support calls from a number of agencies. There's a lot more. I couldn't put them all on, but we do spend a lot of time talking to people about smoke-free housing. I get a lot of calls from tenants that are concerned about the secondhand smoke coming in. I also get calls from landlords who want to go smoke-free, and we work with both of these groups to try to increase the supply of smoke-free housing. We do outreach at trade shows in other areas. We do outreach to the non-profit sector, as well as the housing co-op sector. Also reach out to the condo sector and the rental sector as well. I highlighted Richard here because Richard's a property manager with Skyline that's just been tremendous on this issue. He's been a real leader in creating more smoke-free housing. And in fact, he's coming to give us some support and advice at an upcoming meeting in December. Work with public health units around the province. This is just a few of my colleagues in public health. This is Sarah and Claire from Toronto Public Health, and that's Carol and David from Ottawa. We do work together in terms of creating situations where we're able to provide our education to landlords and to tenants and other housing providers about these issues. Also work with in partnership with other public services. For example, this is Alex from Markham Fire and Emergency Services. He's been a great support at helping us outreach on this issue to the fire prevention community. We're going to know a little bit more about fire later on, but it is a factor when it comes to considering these policies. And by the way, though, although I am in contact with Alex, that was through one of the contacts with the public health units. The public health units have been invaluable at helping getting the word out about smoke-free housing. In the NGO sector, including Heart, Lung, and the Canadian Cancer Society. Add a little bit more about the Canadian Cancer Society Smokers Helpline because we're started to do more work with them in terms of addressing the issue of people trying to quit when these policies are coming up. Most of you probably know, but I'm just going to give a little review of what multi-unit housing is so that we know what we're talking about. Generally, the types of multi-unit housing. There's private rental and there's non-profit rental. There's condos, there's co-ops. And the classification includes senior housing and student housing under private rental, as well as possibly a non-profit rental. And by the way, for those of you interested, this is a picture of the Bing Co-op in Toronto. Is a big shocker to any of you, but the smoking rate in Canada has declined. It's still not as low as many of us would like, and this is a Canada-wide picture. It doesn't take into account all the regional differences, but we have headed the longer term in the right direction, but it's leveling off a bit. Nevertheless, the lower levels do make it more possible to think about these policies in terms of creating more and more smoke-free spaces. smoking is more than stinky and annoying. It's a toxic mix of 4,000 chemicals. This is an important point I find when I'm doing outreach on this issue. A lot of people think of smoking as a risk. They know it's a health problem. The secondhand smoke is not good for you, but there's an underestimation, in my opinion, of what that risk is, and I really have to emphasize it. It is in fact toxic, and we wouldn't allow anyone to emit another type of toxic substance within a building. So it seems very strange that we allow smoking. Now, with that in mind, when we talk about allow, note as I go through this presentation that we take a voluntary approach with the landlord. We're not calling it legislation or a political action. We're largely, calling for landlords in the private and the public sector step up to the plate and create more smoke-free spaces. So it's secondhand smoke. Of course, here many of you are health professionals, and it's linked to a number of issues, including asthma, respiratory, ear infections, SIDS, and heart disease. And the best science that we have indicates that there's no safe level of exposure. Smoke is something that we hear more and more about it, and it's essentially residual tobacco smoke contamination. Includes OCs, off gas. It can take weeks, months, depending how much is in there. And react to chemicals to form secondary pollutants such as TSNAs as well. Health professionals recommend smoke-free homes and vehicles. That won't come as any surprise to you. In fact, when we brought our child home, some of the nurses were very clear about ensuring that our home was not just smoke-free, but that people were to visit our son. He was a baby, and probably in the future as well. That they should be careful not to wear a jacket or clothing that they'd recently been smoking in. So it's a big issue, and especially in apartments where people are there quite a bit of time. Well, how does it get in and out of the unit? Almost any way it can. There's just a few examples: cracks, electric sockets, ducts, pipes, etc. Also, changes in air pressure can lead to smoke transfer. This is a very common source. We hear about a lot of people that receive smoke into their units from people smoking below or beside them. Ventilation. Well, vents and fan, can that help? Well, kind of. It might be able to reduce some of the irritation, but it's probably not going to deal with the health effects. Friends agree with me. ASHRAE is the certifying body for engineers in this particular area of engineering, and their policy indicates that the only effective means of eliminating the health risk associated with indoor exposure is to ban the smoking activity. As mentioned in the introduction, the scale of this is very large. 1/3 of Ontario multi-unit housing residents report exposure. That equals approximately 780,000 people. It's more. Depends on how we count, but I believe that's 800,000 people. That's a significant number of people that are exposed. And keep in mind that the exposure in an apartment exposure is problematic everywhere, but in part we put a lot of time at home. Apartments, sleep, the cumulative effect really adds up. Policy. Well, it goes above and beyond what's required by a provincial law or municipal bylaw. In this case, we're talking about the Smoke-Free Ontario Act. Municipal bylaws might apply to areas like perhaps setback from the entrance or exit. And law covers indoor common spaces such as hallways, long stairwells, garages, and that provides a certain amount of protection. But I'll just tell you a little bit about a call I had yesterday. It was with a woman whose neighbor had the door open, and she was smoking on a really regular basis, and all the smoke is seeping into the hallway and into her unit. It pretty much defeats the purpose or the intent of the provincial law, although it doesn't yet, because the provincial law talks about people smoking inside the hallway. It doesn't talk about smoke going from unit to unit via the hallway. Policy is a policy that includes areas not covered through laws, units, grounds, and does not include, I have a section about, does not include, just 1 minute please. I think that please mute people, getting a lot of background. Thank you. The policy does not prohibit smokers from renting or buying or becoming members, and members are there in the case of a co-op. And it certainly does not automatically evict tenants or members or owners who are smoking. It doesn't force people to quit, although that can be encouraged. And the reason we like to stress that is because it's about the smoking activity, not about smokers as people. And that's an important differentiation to make. This is a very popular measure. Given a choice, all other things being equal, 80% of current residents in multi-unit housing would choose a smoke-free building. This is all things being equal. They're choosing one building with a smoke-free policy and one building without. So this does seem to be a lot of demand. A study was conducted by Ipsos Reid 2 or 3 years ago. The demand has probably increased by now, but it does give us a sense of what people want. Smoke-free policies are a fire risk. This was mentioned earlier, but just to give you some figures associated with it, it's the #1 ignition source for residential fire fatalities. 1 in 4 fire fatalities are caused by smoking articles. This is according to the Ontario Fire Marshal and Marshal's office. Smoking, when it does cause fire, it does tend to cause quite a few more fatalities and other types of fires. It's a serious problem all around, and it can be prevented. Policies is a good way of dealing with issues such as smoke residue, tar on walls, ceilings, appliances, and it can reduce the painting and the maintenance required. The pictures, as noted on the slide, are from a unit in Haliburton, Ontario. Where possible, I like to use pictures where I know where they came from. And this was a unit that required quite a bit of rehabilitation. It's not always going to be like that, but it does give you a sense of the damage that can be done. From New England. In New England, they looked at non and light and heavy. And they gave a sense of what it's going to cost to turn over a unit. Now, these figures are 2009. They're probably up a little bit, and there's also in the States. But I like the slide because it gives a sense that there is a range going on. But generally speaking, it's about even smoking. It's more almost 3 times as much as a non-smoking. This is a big factor at persuading private and public sector landlords. On the public side, as we know, there's not much money in the system, or not as much as we need, and there might be a way of eliminating some extra cost. Free policy obviously offers a healthier environment for both tenants and for staff. The tenants people think of immediately, but I'd like to point out that it includes staff as well. There's a lot of staff associated with buildings that have to go in and They have to do repairs, meet with tenants and residents, and the staff often end up going into, which is essentially a polluted environment. Even if they haven't, in a short period, maybe half an hour before, there's still residual smoke in the units if they're a heavy smoker. So it's just a safety issue all around. Smoke-free housing or smoke-free homes is associated with increased quit attempts, reduced consumption, as well as abstinence. So there's some indications that these policies lead to more quit attempts. So we get a lot of questions from landlords and from tenants about quitting smoking. We're primarily working on the protection side, but more and more we're trying to bring people in on doing a bit more on cessation as well. And we like to highlight these resources from the Canadian Cancer Society, as well as, so one of them on the left is a booklet that's available, and the one on the right is a poster. I suggest to people, because it's easy, I suggest that they contact Smokers Helpline and find the resources that are right for them. Now, one thing that we've learned from experience in this issue is that we have to be careful not to alienate smokers or ostracize them within the building, because when the policies come in, they may already have the explanation that it's about the smoking, not about smoker. Some of them may feel alienated and they won't be receptive. So what we suggest is have resources on hand, as well as put up information, walls and elevators about ways of quitting and what kind of supports are available. The region of Waterloo has gone non-smoking since 2010, and there's been several evaluations. An evaluation in 2013 found that 45% of respondents reported tried to quit in the last year. So there does seem to be some quitting going on with the policies, and I find that very encouraging. Smoke-free policy is there to protect people. And as you know, if you look at the Ottawa Charter and Public Health, the shelter is listed as a prerequisite for health. But if the shelter is poisonous, it's hard to imagine it fulfilling that role. If we get calls all the time from people that it's great, they feel glad they've been housed, or they have housing and they're afraid to lose it. But they might because of the smoke coming in from the neighboring units. By the Canadian Child and Youth Health and Housing Network. This is the air quality. Air quality significantly influences health and outcomes for children and youth. And as you know, it's associated with diminished lung function, asthma, headaches, and difficulties. So I guess the reason I'm putting this out there is because it's clear that the secondhand smoke affects the air quality and affects other health outcomes. The health of people in lower socioeconomic brackets is already at greater risk. There's lots of cases, lung cases, some of them not as severe as others, some of them are just bronchitis. I'll have more severe cases of COPD and other issues, asthma. So, for people, especially in the public, people housing in the public sector, social housing, their health is already at greater risk, and this is just one more thing negatively contributing to it. People living are wanting to gain housing that's rent geared to income. The wait is horrendously long. In some cases, it can be more than 6 years. So you can imagine people that have housing that's rent geared to income I don't want to give it up if they get there, but you also can imagine how frustrating it must be if they get there and they can't enjoy it, or they feel like their health is at risk because there's smoking going on in their neighbors, and the smoke is seeping to their unit. It's taken from the RNAO website, but I find it helpful to look at the social determinants of health. These are circumstances in which people are born and grow up, live, work, age, and systems that are put in place to deal with illness. So people are born into housing, grow up in housing, live, work, age. All of those things are there, and this is one of the reasons that we are anxious to get rid of smoking in senior housing where it's possible. More on social determinants. There's just a few that I circled. There's affects employment, working conditions, early childhood development, of course, housing, and as well as disability. Issues that often come up. For rental housing, the main piece of legislation is the RTA, the Residential Tenancy Act. Smoke-free policies are legal and they are enforceable, usually under reasonable enjoyment. The policies must be grandfathered. In other words, they affect new people, or in some cases, people will agree to a smoke-free policy by signing an addendum to their lease. But the bottom line is that the tenants, residents, must agree to the change in order for it to be in effect. It means that sometimes it can take a while for a large housing provider to go smoke-free, but they get there eventually. The concept is pretty clear. These policies are legal and enforceable. There's a vote by owners and the board through the three mechanisms: rule, bylaw, or a declaration. That can also go smoke-free. They are legal and enforceable, and this is done through a vote of the members and a vote of the board. This is a picture of a co-op that I'm familiar with. It's a rooftop garden at Hugh Garner Co-op in Toronto. So a lot in this discussion. I think that's a critical piece. But smoking is not a protected right in Canadian law. So there's nothing in the Ontario legislation that indicates that smoking is protected as a protected ground. A number of other areas, of course, are listed, nor in federal legislation. In fact, the Rights Commission has they did a report on housing in 2009, and they addressed this issue by talking about the duty to explore accommodation with tenants with forms of disability. But they do point out that given the inherent risks associated with smoking, a housing provider may have little or no obligation to accommodate a tenant's need to smoke when it would amount to undue hardship. An example they give is negatively affecting the health and safety of our tenants. So given how toxic secondhand smoke is, I think it would easily meet the standard. That said, it's not impossible for someone to make a challenge under the to the tribunal, but it doesn't seem likely to succeed under given what the Commission has said and some other rulings in Canada. Advice for housing providers is important, and we recommend that working groups involve tenants, residents, board, staff, and other parties involved in the housing. It's important to get as much consensus as possible. It's helpful to conduct a survey about the needs, needs and people in terms of how they're feeling about secondhand smoke, as well as their willingness to support the policy. It's very helpful to indicate what the policy is going to be or likely to be. For example, if it's grandfathering because it's a residential tenancy situation, the survey preamble should say that so that people don't get the impression that they're going to be evicted suddenly if the policy comes in. Policy that works for the building, the buildings, something an outdoor setback, a certain distance, let's say 9 meters from the door or the intakes, air intakes. Sometimes it includes the balconies. We strongly recommend that it includes the balconies because we know that's where a lot of smoke is coming in. Communicating this information is to the tenants and to the wait list if it's a housing provider is very important, just to make sure that people understand that policy is in place. And although lawyers will just say, communicate what the policy is, in the area of health promotion, I find it especially helpful for people to understand why the policy is in place, and I think downstream it increases the level of compliance. So I usually say that, put in some information about that this is being done for the health of residents and the safety of residents, and that will both help to explain it as well as increase compliance. Also, sometimes in the communication materials, I recommend that they include the no smoking symbol as an adjunct to the written language, just so that everyone's reading the document will clearly understand what's going on. Progressive enforcement is important. You don't want to put people in position of being evicted unless it's absolutely necessary. I'd like to ensure that everyone has safe and affordable housing personally. So we suggest that the progressive enforcement approach be taken. So it might be a call, it might be a visit, or it might be a letter, depending on what the systems are set up for the housing provider already. A little bit of advice for tenant. A letter of complaint, putting the concerns in writing is important so that people understand that they're able to articulate it, as well as sometimes written complaints get better responses. They can attempt to block the smoke through caulking and other mechanisms. It's not really to result in a perfect health situation, but it could reduce the amount of toxic secondhand smoke. Getting a letter from a health professional can sometimes be persuasive, and document everything. And we have tools on our website to help people do this. So decide, are they going to stay? Do they stay or move out? Neither situation is completely ideal, but here are options. If they're going to stay, they're negotiating an agreement with the tenant that's smoking or the landlord. Improve the ventilation, might reduce irritation. They could think of a transfer. If the health condition, just some sort of reasonable accommodation. And if needed, follow with the landlord and tenant board, citing reasonable enjoyment. And if health condition exists, consider the human rights tribunal. Put the request in for early termination. No agrees, and that's done. And if they don't agree, then applying to the board for termination might be a good step, because not only can the board act and release early, the fact they file with the board might get the attention of the landlord, and there might be a mediated settlement. With the board, there's no guarantees, but it is possible. For example, it's just a list that I was able to fit onto one page, but there's actually lots, and I'll show you where the directory is in a few minutes. This is how a partial response of the nonprofit and co-op housing sector. You can see there's a number of housing providers on this list, including some large ones like Ottawa Community Housing, and also Thunder Bay, although somehow didn't make it onto this list, but Thunder Bay is up there too. This is a slide from a newspaper article from Cochrane. This is a brand new facility that's going to be smoke-free from the get-go. The sector, rental and condominiums are responding as well. Drulo Holdings is a developer in Southwest Ontario. Skyline, as I mentioned, individual condos like Vista, Domicile, galleries, retirement living places like Signature, some private student housing. You can see the list. It's just a few examples from around the province. From Domicile, which is a boutique condominium builder in Ottawa, they find that these policies are very popular. As I mentioned when we started, what people are saying about smoke-free housing. This is Brian, and Brian writes that after spending thousands of dollars trying to prevent secondhand smoke from infiltrating unit, it became apparent that the only and best solution was to make the 90-unit condo a smoke-free facility. He feels very strongly about this and gave us a picture and a quote. One person, but I'll go back to it if there's time. This is Carol. Carol is a great leader in this. She works for the Cochrane DSAB, and with the cooperation and support of the board, going smoke-free has been one of the easiest policies to implement. She works in the housing sector where it can be difficult to implement a lot of things, but it still tells me that it's quite possible within the housing sector, or the non-housing sector. The Paul experience as well, the regional municipality of York, and he points out that their policy carefully considers tenants' needs while their goal to create healthier communities. It's been a good step for York. Drulo is the vice president of Drulo Holdings. When we realized it was legally available to us, we decided to give it a shot, and we're quite happy we did it. It's been it's been quite successful. TCH, Toronto Community Housing, is a very large landlord, so we follow them carefully. They do not have a smoke-free policy right now, but they have surveyed their residents, and what we heard was that 76% of residents support moving towards a smoke-free policy, and management is committed to discussing options with the board and possibly a smoking policy. Dr. Warner from the Mayo Clinic. There's really no way to protect people in buildings without some level of secondhand smoke, or without simply making housing structures smoke-free. In Hampton, she has CF. So her situation is particularly acute, but she's told her landlord that it's a life and death issue. Tenant in Waterloo Housing, this is from the survey that they did. She said, I support the policy as I don't want to be tempted to take up a lousy habit again. And that brings me back to the issue of that I mentioned earlier of quitting and staying quit. Now, we're happy to live in healthy lives but have no control over the smoke that we are forced to breathe in. And this is about the problem of involuntary exposure for residents of multi-unit housing. Sources and more information available on our website. Our website contains a large number of items, both online as well as downloadable PDFs. For sections, I'm just going to mention a few of them. We have a section for tenants, lords. We also have some video resources about smoke-free housing that encapsulate a lot of what I've been talking about today. Resources including Landlord's Guide to No Smoking Policies in Ontario, as well as a tenant's guide. booklet about implementing smoke-free housing policy. And something what we call it the quick guide for tenant inquiries is to we use this a lot to support inquiries from our partners in public health and nonprofit sector. It quickly gives people information that they need in case they do get an inquiry. And it's a growing area. A directory. This is a directory that just last year I added the more private sector housing directory, and it's right now its format is a bit limited. It's in the form of a PDF, but it's sorted by city, and the PDF is searchable. We have future plans to make it an online database. Me to our last slide. This is me again and my contact information. I just wanted to add, this is something breaking news. So if we've got, of course I watch, we've got a few minutes, but I wanted to talk a little about the issue going on a North American-wide basis, because there's some news that you'll probably hear about soon. The Department of Housing and Urban Development in the United States looks like it's going to be requiring that all housing that they fund go smoke-free. And this is as a result of this issue working its way through the United States, with a lot of housing providers taking on these policies. It's sort of breaking news. It was just the story was published today, and I'm going to be on a call later on this afternoon to find out more about the details. But I think it's quite promising. So that's the last bit of information I have today. I'd be happy to take any questions.
Thank you much, Andrew, for that excellent presentation. And as Andrew said, we'll take a few minutes now for questions. So if you do have any questions for Andrew, just a reminder, if you could type them into the chat box. Andrew, one of the questions that came in was just in regards to the fact that you had mentioned that Waterloo is one of the municipalities that have implemented smoke-free multi-unit housing, and just wondering whether any other municipalities in the province have also gone this route, or and that might be doing so in the near future that you're aware of. And you're not sure if you're speaking, but we can't hear you.
Okay. There's a lot of municipally owned and or operated housing that have gone smoke-free, including the 15,000 unit Ottawa community housing. There's also Renfrew recently announced that they're going to go smoke-free, or trend to smoke-free as of January 1st. There's smoke-free housing in Haliburton. If anyone's interested, we could keep a database of the smoke-free housing, and I can offer a list. But it's a growing number, and we hope that it will grow even further. There's a lot of support for health reasons as well as economic reasons in the social housing sector.
Another question is, what do you think is the biggest barrier at this time to implementing smoke-free multi-unit housing, implementing it province-wide? What would be the biggest barrier that you face?
Well, right now, as I mentioned, we're not advocating for legislative change. There are some legal issues associated with if there were to be a legislative change, and there also might be some political challenges with that. The issues are complicated, and as I mentioned, I'm not a lawyer, but part of that involved that provincial legislation regarding smoking is enforced by tobacco enforcement officers. Those officers, do not, unlike a restaurant, they don't have the authority to enter somebody's home in order to inspect without a warrant, and it's really not feasible right now. There are also some political barriers to that. The government has moved forward with some terrific amendments to the Smoke-Free Ontario Act. My suspicion is that the reality is that's probably what they're going to be doing in terms of the term of government with I think that the barriers at the on the voluntary level are tied to education. The fact that it's legal to do this, and that there's support available for doing so, including model language. The public sector has moved forward more quickly. I think it's because we've got better access to them through our partners in public health. And the private sector is growing. I did a presentation at the Hamilton District Apartment Association and found there's a lot of support. In fact, a lot of those private landlords have already moved forward with smoke-free policy. What they want to know, the private sector, and I guess to a certain extent the public sector, is that this will be a relatively smooth transition. And what I'd like to point out to them that is the smoke-free policies are legal, and the past experience has been that they've been fairly smooth. But I also like to point out to them to be realistic. A smooth transition does not mean that there's going to be 100% compliance. If you implement any policy, there's going to be a certain amount of non-compliance. And to make it smooth, you have to put steps into place, including making sure the policy is right for you and deciding in advance how you're going to enforce it. So, when you understand that, then a lot of people are willing to move forward with the policy.
Another question is just in terms of the work you do from day to day. Do you find that most of your inquiries from the public come from landlords or from tenants with questions regarding smoke-free housing?
Well, by sheer numbers, we have more tenants or individual dweller, like residents that call us, because there's a lot more of them than there are people that are in charge of housing. But we also, and similarly, the most popular section of our website is for tenants by weight of numbers. But more, we get calls from some of the the owners, as well as from building managers that want to go smoke-free and looking for some support. So it's a mixed bag, but it used to be that we'd get calls. It used to be purely calls from people that are complaining about secondhand smoke, but now the idea is catching on, and the word is among the landlords and other property managers that this is an option, and many of them are willing to consider it, provided that they can T's and dot their I's.
Okay. Last question is, and I think maybe you probably sort of answered some of this in answering your previous questions, but any movement at this time towards smoke-free housing in single-unit dwellings? So in a single-family home, for example, where there might be issues around exposure of children, let's say, to secondhand smoke.
Of course, we're in favor of that because protecting people from secondhand smoke is extraordinarily important. We focus on the multi-unit housing aspect because we're trying to get more bang for our buck in terms of getting a smoke-free housing to everyone. But we're fortunate, though, that the work of public health has been such that many families, even with several smokers, they have their own internal policies about being inside, and many smokers will happily step outside in their home in order to protect the health of their children or spouse, or sometimes it's not even a human factor. Sometimes it's to protect the pets. But we do find that people are willing to do so. I can't remember the latest figure, but I think that it's down to about 6% or so of households of those that smoke allow smoking inside. But I'd have to go look that up.
And I just see another question has come through here. Policies are great, but are there any supports in place to address issues of stigmatization and implementing policies?
I'm glad that that's raised, because the issue has to be dealt with delicately, and it's difficult to hit that issue of stigmatization right on, because people are going to feel isolated, and they're going to go, even if there's a vote in the community in the case of a condo or a co-op. These policies work when they're done they work better when they're done from the ground up. And that means consulting with many of the people that are affected, not just the non-smokers. They may not come alongside and be in favor of the policy, but they might feel that they are at least a part of it. One turning point that people often have, it's like a light bulb moment, is when people frame it as the emission of like a toxic substance, or that not so much being told that they can't be a smoker, but they're being told that they can't emit a toxic substance within their unit. And that sometimes brings the light bulb on, as an idea, and people go, okay, I get it. Now I understand what the problem is. That it's not about them as a person. In regression, cessation is always a tricky and difficult area when you're thinking about stigmatization, ostracization. So what I suggest is that to landlords is that resources are made available, options are pointed out for smokers, but not in a way that singles out smoke, more in a way of providing information about contests, which is the Canadian Cancer Study used to offer the Driven to Quit contest. I understand they're switching to smaller contests on a monthly basis, but information like that might encourage people to quit as well. But I'm very glad that question's raised, because it's a critical part of the process, in that of bringing people on side and making sure that everyone feels that they've been part of the process.
Great. Just a final comment from Barbara, who says, very informative. Hopefully we follow the American lead. Yeah, well,
it's a good point. I thought it was very apropos that I got that this policy is going to be discussed and announced this afternoon. So you can probably watch for it on your news. Look, I just noticed the New York Times has got an article out about it.
Well, on that note, I would just like to thank you, Andrew, very much for today's presentation. Extremely informative and some really great information. Our time now is basically almost up, so I just as well would like to thank everyone for participating in today's webinar. All of our webinar participants will receive an email from RNAO within the next 24 hours or so, and it will link you to a short evaluation survey for the webinar. Once you've completed the survey, then you'll be able to print a certificate of completion for today's webinar. I hope that you learned a lot today, and that you will continue to join us for upcoming webinars. Please do check our Tobacco-Free RNAO website on an ongoing basis for a list of upcoming webinars and events. Our next webinar is on December the 1st, and it's entitled Party Without the Smoke, Young Adults' Use of Cigarettes and Alternative Products, Why and How to Intervene. And the webinar will be facilitated by Lindsay Taylor and Tyler Moon from Leave the Pack Behind. So once again, thank you very much, Andrew. Thank you to all our participants who joined today, and we hope you'll join us again in the future, and have a great afternoon. Thank you.
Thank you very much.